When an emergency call is answered by the dispatcher, things need to move fast. The emergency response team should get to its destination as quickly as possible and take care of the patient as a well-oiled machine. It's crucial that all team members remain calm, knowing that everyone knows what they need to do. ISIMED offers training courses for experts in Dresden to prepare them for an emergency response. ISIMED stands for Interdisciplinary Medical Simulation Center and is a joint project between the Faculty of Medicine here at the TU Dresden and the University Hospital Dresden, and dates back to an initiative by the Clinic for Anesthesiology and Intensive Care Medicine. 10 years ago, we started to establish and operate a variety of different simulators here, where students, physicians, nursing staff, paramedics and physicians from other facilities are able to primarily train for emergency situations and achieve the best possible performance. Training simulations are always done with very small groups. That is to say, we have very few participants and a high percentage of practical training. There is instruction on how to use the simulator. This is the human patient simulator, for instance, which responds like a real human being in many ways. However, it remains a doll and therefore is a plastic being. The doll's skin cannot change color like a real human being, of course, and is not able to perspire. We explain the functions that are realistically represented and those functions that we are not able to display to participants. We regularly experience that participants are very quickly engaged and react the same way they would in real life. When we have a 2-day course, almost the entire course consists of practical exercises on the simulator. And this almost always means us conducting a short briefing, that is, we introduce the scenario, assign tasks for the participants, the physicians, nursing staff and paramedics. Then they move behind a closed door and work on a lifelike setting. This can be the operating room, the intensive care unit, the emergency room, or perhaps an ambulance or rescue helicopter. For about half an hour to 3/4 of an hour, the participants are allowed to work in this scenario in real time entirely on their own. During this time, we shoot a film, make sound recordings and transmit the story live into another room with those participants who are not participating. They watch and receive observation tasks. After the scenario, we need at least the same amount of time to review everything. We conduct video sequences of individual activities that are especially good or show room for improvement. We discuss this among the participants along with a moderator, usually a psychologist and a medical course instructor. As a result, we need to build a very familiar atmosphere with the participants. The rule is generally that when there is a debriefing in a room, meaning a review of the scenarios, the door is closed and everything that is being said here and everything that is being used in terms of video recordings does not leave the room. This means the participants can be very relaxed in discussing the mistakes they made in those scenarios. And we are always thankful if a mistake is being made on the simulator, because once I've made this mistake on the simulator, I won't make it again with the patient.
Weil wenn ich den einmal am Simulator gemacht habe, dann mache ich den nicht nochmal am Patienten.
If there is an emergency in the Dresden clinic, the nursing staff in the individual wards are urged to call the medical rescue team immediately. We hope that we are called early enough so that the patient is still well enough to where we can avoid intensive care treatment. But even if the patient is doing poorly, if he or she needs to go to intensive care or if we need to resuscitate, the team should still deliver an optimal performance to where I always compare us to Formula 1 racing. You can only be perfect in something that you practice regularly. Our resuscitation results show that those who regularly come to ISIMED for many years and train deliver great results in resuscitation and emergency treatment at the wards. To err is human. However, this quotation doesn't comfort helpers if there is a fatality during an emergency. Even trained medical staff can reach their limits in this instance. Before this leads to a traumatic experience, people should therefore be familiar with strategies that help in handling these types of situations. What we do here is train for emergencies that end in a fatality in the worst-case scenario. These types of events put quite a psychological toll on the physician. especially if a personal component were added to this, meaning if you are dealing with a child that is perhaps the same age as your own or has the same name, or if I've experienced several similar events in a short amount of time that ended in death. In that case, you should definitely check and see how the colleague is doing, whether he or she perhaps needs follow-up care or whether he or she wants to talk about the event again. In the worst-case scenario, it might even lead to an inability to work because the person tries to avoid the situation, because he or she is afraid to provide services and is afraid to get into a similar situation again and make the same mistake. What is so special about our simulator center is that we jointly attend these trainings with a physician and a psychologist. That means we are not just focused on conveying medical knowledge, because we assume that our physicians and nurses are very well trained. We emphasize teaching these psychological elements as well. That means, what am I doing with my medical knowledge in a stressful emergency? Am I able to use my knowledge correctly in this type of situation, and can I communicate effectively with my colleagues? Am I a good team leader? Am I capable of assigning tasks sensibly? And do I perhaps have a plan B if my plan A doesn't work? All of these are so-called non-technical skills, and it's our goal to teach the teams these exact strategies so that they are able to apply them in real situations they have previously practiced here with us.